Coming up on diagnosis is something new to many nurse practitioner students and new grad nurse practitioners, even for those who have many years of nursing experience. I myself worked as a registered nurse for 4 to 5 years before becoming a nurse practitioner and still struggle with a new role of nurse practitioner, especially diagnosing conditions for my patients. In this episode, I will review 3 tips to improve your skills to come up with the right diagnosis. Hi, we're gonna get into today's topic in a minute. But before we're gonna dive into today's topic, I just wanna mention that we are giving out free access to our online workshop. This workshop is about confidence. We had this workshop and we got so many good responses, feedbacks from the audience. So I wanted to give it out to more people so that you can boost your confidence and get more career opportunity, get into your dream nurse practitioner programs, and get pay raises. How you can sign up and how you can get access to this workshop is go to a website, usa.jnpproject.com/confidence. Again, usa.jnpproject.com/confidence, and sign up for our free email list. This is a 90-minute online workshop. You can watch it as many times as you want. It also comes with a handout of the slides that I used in the workshop. Again, a lot of people loved it. It really helps to boost your confidence. So I want you to have the opportunity. So please sign up. All right, let's get into today's episode. So this episode is about how to get to the right diagnosis. So diagnosing conditions and deciding on treatment plans are something that nurses don't do. When you work as a nurse, there's diagnosis already made and you implement those treatment plans safely. That's the nurse's job. But when you become a nurse practitioner, you're the one who make diagnosis. And it takes some adjustment to get used to the role. And actually, I realized that it might be a little bit harder for those who have a lot of nursing experience, although that experience are very helpful. But because you're so used to the role of having diagnosis already and being a nurse, trying to switch the brain, I had this problem myself, trying to switch the brain from follow the diagnosis that somebody made to being the one who made the diagnosis. So that was something that I struggled with initially. But there is a way to make the right diagnosis. So I'll go over that today. First tip is to use symptoms as diagnosis when you are uncertain of what's going on. So for example, if you have 20-year-old female complaining of generalized abdominal pain, you're a medical assistant, the UA pregnancy test, it was negative, UA showed some leukocytes but no nitrites. And you read up to date and decided to order some blood tests and abdominal ultrasound, as well as you decided to order some urine culture to rule out UTI. In the setting of primary care, you don't get the results right away. So when you're finishing this visit, you still are unsure of what's going on with your patient because you still have to wait for ultrasound to be scheduled, and also patient goes there to do the ultrasound and then the report to come back. So you're not sure the results yet. So you can't diagnose, you can't say, sometimes you can say, but sometimes you cannot say what's exactly going on because you're waiting for the results. In those cases, it is appropriate to put symptoms as diagnosis. So for this case, it can be acute generalized abdominal pain. I like to put differential diagnosis just to show that what I was thinking, what I think are likely. So for example, I might put differential diagnosis, UTI, and I might also, if I think that one condition is more likely than the other, I might put likely this and that, and other differential diagnosis, this and that. Other times you are sure what's going on, then use the names of the diseases. So for example, that urine culture come back, it shows E. coli, and you diagnose with UTI because you have evidence that she has positive urine culture with E. coli. Or sometimes you might not have to wait for the lab results and you can diagnose with clinical manifestation or exams. So maybe patient have upper mid-back pain, fever, chills, nausea, vomiting, and some pain with urination. And UA come back positive for leukocyte and nitrite. You did severe tenderness and it's positive. Patient is febrile. You can diagnose with pyelonephritis based on clinical presentation and physical exam findings. So when you are sure, okay, this is what's going on, you can put diagnosis on that. In some cases, you know what's going on, but also you are not sure that's the only thing that's causing the pain or issues. So you might want to put two things, like you might want to put UTI, but also abdominal pain. And under the abdominal pain, you could write down likely due to UTI, but order some other tests to rule out other causes. Third and final tip is to practice diagnosing conditions when you are doing rotation as a nurse practitioner student. This process takes time to get used to this new role. As a nurse practitioner, we always had to make decisions on diagnosis, make decisions on treatment plans, which treatments to do, which medication to prescribe, what dosage, how long, how frequent, which imaging, like X-ray, is it ultrasound, is it MRI, does the patient needs to get contrast or non-contrast. You always have to make the decisions. And how you can get used to it is you actually have to practice. Just observing somebody doing it doesn't really improve your skill. You have to actually practice on your own and get feedback. That's the best way to improve the skill. So for my students, I usually have them diagnosed. I teach them how to do oral case presentation. And if you haven't watched that video for oral case presentation, I will highly recommend to watch that. But so when they do oral case presentation, I ask my students to make diagnosis. They can be wrong, but the important thing is they practice the skill and I can get feedback. Sometimes they get it right, sometimes they get it wrong. That's okay. But getting the feedback and getting used to diagnosing condition is extremely important. I hope this video was helpful for you. If you have any questions or concerns, please write down in the comment section. And if you like this video, make sure to subscribe to my channel. I issue a video every week that is helpful for international nurses, nurse practitioner students, and newly graduate nurse practitioners. All right, I'll see you in the next episode. Aloha.